introduce 4 people that I've been working very closely with for over almost 3 years now, and we're gonna hear from them about what they have done. We're gonna hear about CAMH's, the Center for Addiction and Mental Health, initiatives to enhance psychological health and safety, and working with the union partners. So I'm going to introduce 4 people. Carrie Fletcher, first the CAMH VP of People and Experience. Carrie has a healthcare career spanning 23 years. She currently holds the role of Vice President, People and Experience at CAMH in Toronto. Ms. Fletcher has spent much of her focus and energy over the past 4 years working collaboratively with CAMH's unions, ONA and OPSU, to support improved health and safety of CAMH's staff, physicians, volunteers, and students. She never thought on her way to Tim Hortons one day when she was asked to take over the employer co-chair role on the Health and Safety Committee that we would be here today, but here we are. And I can't thank her enough and for the other speakers of the work that they've done to date. So she's responsible. She led the joint committee at the time when they were doing the full reset of the health and safety committees, the inception of the Workplace Violence Prevention Committee, and that work has been integral in improving and the highly positive working relationships with the unions. So Carol Mundley, I want to proudly introduce Carol as, OPSU Local 500's worker co-chair for the Joint Health and Safety Committee. Carol's been working as a registered practical nurse at CAMH for about 18 years. She has served as an OPSU steward for more than 17 years and is co-chair, like I mentioned, not just on the Joint Health and Safety Committee, but the Horizontal Violence, Anti-Racism, Anti-Oppression Committee, and one of the initial members of the Workplace Violence Prevention Program. So Carol has lots of different hats in the union as well. She is the provincial health and safety coordinator of our mental health division at OPSU, chair of the regional coalition of racialized workers, and previously chair of the provincial women's committee at OPSU. She's a passionate activist and advocates nationally and on the global stage, actually. Now over to David. David Tennant is the president of local ONA, the Ontario Nurses Association, Local 82. So David is, Local 54. David is a registered nurse with over 32 years of direct care experience. So he began his career at CAMH at the Clark Institute of Psychiatry prior to the merger. And David has various psychiatric nursing experience, including his work at CAMH in the schizophrenia program, the forensic program, lots of different programs. But 2/3 of David's career has been as a highly involved member of the ONA local bargaining unit at CAMH. So for 21 years, he has held the positions of VP grievances and as the vice coordinator for the local's 5 bargaining units. This experience led to a successful confirmation recently by the bargaining unit voting him to the position of the bargaining unit president and the coordinator of ONA Local 54. And Thomas, I'm very proud to introduce as the president of OPSU's Local 500. Thomas has more than a couple of thousand members there at CAMH, and Thomas has had a variety of careers before December of 1997 when he was hired at the Clark Institute as a clerk in materials management for a 1-month contract that continues to this day. So prior to this contract, Thomas has been a client with the Work Adjustment Program. This was a program at the Clark Institute that found volunteer work opportunities for individuals living with mental health issues. So from the time of the merger, Thomas has been involved in OPSU Local 500 at CAMH, serving as a steward, a secretary, lead steward, and now president. So these 4 are going to lead you through a path that CAMH has followed and that I'm very proud of, and I'm very proud of them. Over to you guys.
Welcome, everybody. We are thrilled to be here today. My name is Carrie Fletcher, and I'm co-presenting with Carol Mundley, and we are going to take you through how CAMH has worked jointly with our unions and with management to address both physical and psychological health and safety in a mental health hospital. So today we're going to be taking you through a number of topics, just a brief intro to CAMH, how we really reset our relationship between our unions and management, how we structured our workplace violence prevention committee and work for success, what some of the outcomes of that work were, of course, the impact of that work, and then building on the success of the work around workplace violence prevention and the physical nature of it, heading into our work around psychological safety for our staff. And finishing off with our journey continuing, because this truly is a journey that will never end. We'll constantly be working on this. So a quick introduction to CAMH. CAMH is Canada's largest research and teaching hospital dedicated to mental health. We have approximately 3,600 staff who are primarily unionized staff between two unions represented by OPSU and by ONA. And then we also have approximately 200 full-time physicians and additional physicians who are residents, fellows across the organization. We also support close to 35,000 unique patients per year, and we do have 550 inpatient beds. Our strategic plan is focused on the next 3 years. So we rolled out the strategic plan back in June of 2020, and it is called One CAMH. The vision of the organization, Health Redefined, our purpose is position mental health at the center of healthcare. And our belief is that mental health is health. This is not solely for our patients, this is also for our staff as well. And you're going to see how we are working to create not only a physically safe work environment, but also a psychologically safe environment. In terms of a relationship reset, I'm going to hand it over to Carol, who's going to paint you the picture of where we were at approximately 4 years ago, to see how this work really got initiated. Carol.
Thank you very much, Carrie. As Carrie has pointed out, 4 years ago, we embarked on the journey of ensuring physical safety within the workplace was a priority and continue to be a priority. And everyone will agree that in 2017, tensions were extremely high, where you saw management and the hospital, two unions were the tension was at all-time high. And although the work was during that time, the work was underway, today we can say that the work has actually continued, and while it has gotten easier and the relationship is no longer strained, every day is a challenge. Every day brings forth a new challenge where it tests exactly how much commitment exists between the employer and the unions, and how can we ensure that we're looking at making sure that the workplace itself is as safe as possible for everyone who works, and whether it's the patient or the employees, make sure that everyone is safe within the workplace.
I do also just want to note that, to Carol's point about the tensions being so high, this is just a sample of the letter that was written by ONA to our Chief Executive Officer, Dr. Catherine Zahn. And this really showed how serious the concerns were. In addition, on the previous slide, you would have seen picketing out front of the organization, highlighting the challenges that our staff were facing on a day-to-day basis. And our two union presidents at the time had also made a visit to the Ministry of Labour over concerns in terms of the organization, the feeling of not taking the action needed to keep our staff safe.
So when we look at what was happening in the workplace violence prevention program, it was soon realized that in order to show real and true commitment to addressing the issue of workplace violence, the CEO, made a commitment to take an active role in ensuring that the issues that were coming forward were being addressed. And at that time, she became the first CEO for any hospital to be actively involved, taking a leadership role in ensuring that workplace violence prevention was being addressed. And at the time, so she became the co-chair of she chaired the violence prevention table itself.
And having Catherine, our CEO, as the chair of the Workplace Violence Prevention Committee was just one of the ways that we structured this work for success. We ensured that this committee had wide-ranging representation that was agreed upon by both union presidents, our local union presidents, but also the health and safety officers and health and safety specialists from ONA and OPSU Central were involved in this. We ensured that we identified individuals that worked in clinical leadership, in our environmental services, in security, in corporate areas. Communications were involved so that we could ensure that we were messaging out to the organization around the work being done. And then, of course, things like setting up the committee for success, a terms of reference that clearly articulated the purpose, the aims, and the function of the committee. So even when we did get off on those tangential conversations, we were able to focus ourselves back on the work at hand. And of course, the rules of engagement. So remembering that the tensions were very high between our unions and management. So we needed to be able to create a safe space where we could share our different perspectives, have meaningful discourse so that we could actually come up with consensus in terms of a decision to move forward. We didn't always agree. There was times when we had to agree to disagree, or we definitely had to give to be able to come up with an effective path forward. But these rules of engagement in terms of reference were really important to ensuring that that happened in a respectful way. Some of the key success factors that I'll be speaking through are that trusting personal dialogue, timely follow through on commitments, and of course, formal communication. So I mentioned having a communications person and ensuring that there was early and often communication, which is, I know personally, a mantra that I live by 4 years later, is early and often communication. Identify things up front, nip things in the bud, and hopefully before things escalate to a really challenging point. So with that trusting personal dialogue, it really was about building personal relationships. Personal relationships between the union presidents and our president and CEO. I was in a different role at the organization at the time, but also with myself to be able to reach out, shoot a text, have a phone call, have a cup of coffee, talk about what was percolating in the organization and how we could address. And yeah, that simple act of sharing those mobile phone numbers, texts between the CAMH CEO and union leadership spoke to that confidence in that. And then, of course, before each workplace violence prevention meeting, there was always a meeting between the committee chair, who again was our president and CEO, and union leadership, both local and central, to ensure alignment and cement those open lines of communication and building those relationships. In terms of the timely follow through on commitment, we wanted to ensure that there was structure to the meetings, comprehensive agendas were sent out in advance of meetings for people to be able to review and allow that so that there could be feedback on the materials and good discussion. And then, of course, action logs where there was accountabilities and timelines for following up on things. And then third, a communication plan. So ensuring that this wasn't just a committee that happened behind closed doors and nobody heard what actually came out of the committee. As the committee got started, we had a blog from our CEO, Call Me Catherine, that would highlight the work of the committee. And then we also had, and unfortunately last summer we missed it for the first time in 4 years due to COVID, but we would have barbecues, annual barbecues, sharing the successes of the committee. So for example, in our first year, we had a one-page document that were scrolls that were handed out jointly by the president and the union presidents to highlight. We had both local and central union representatives working right along management, cooking up, hamburgers and chicken and hot dogs and serving salads for staff with over 1,000 attendees at that barbecue. So in terms of the outcomes, I'm going to hand it back to Carol, who's going to speak to our initial action items.
Thank you very much, Carrie. One of the things that I want to highlight is what came up as one of the individuals who was actively involved from the beginning of the inception of the Workplace Violence Prevention Program. Myself and my counterpart, Kern, who we were booked off for 3 months, where we actually worked closely with Kerry during that time. And what our role was to look at what was happening throughout the workplace, looking at systems, what systems exist and where gaps actually exist. And I must say, the things that we found was astounding. The things that were that came to realization was that the work was extremely. It was crucial for the work to continue, and it was absolutely essential that everyone played a key role in ensuring that workplace is a safe place for everyone to come into. So when we looked at the zero tolerance signage, we recognized that the language did not go. Although there was another sign to say that zero tolerance around violence. We recognized that it did not go far enough to actually name the violence, to name the things that absolutely it was zero tolerance throughout the workplace. So with that in mind, it was brought back to the committee and action was taken immediately to ensure that the signage would be reflective of exactly what the workplace, what the value and the mandate of the committee. So with that in mind, the signage became a lot stronger, and it was posted it wasn't just a hit and miss that the signage were placed. They were placed in every area that you could think of. And the signage themselves became permanent stands in every corner you could think of. When we look at the supervisory competency, being on the Joint Health and Safety Committee, it was recognized that there was a gap, a major gap, where follow-up became, it was not sufficient, it did not go far enough. And so we recognized that there was a major gap there. And when we start examining further, it was recognized that supervisory competency played a key role in ensuring that workplace violence would be addressed, and it wouldn't just be addressed under the covers, but it would be, everyone would understand that if the supervisor was not competent in highlighting and recognizing how to appropriately follow up when there was an incident, even when there was a near miss, then there was no room available to actually make changes and to address issues as they come up. So that was one of the first things that we started flagging. And in flagging that, it was recognized that there was that great need for the 3-day training for supervisors. So while we recognize it to be an extremely crucial part of the overall operation of the organization, you know, with COVID being what it is, there had to be some reset in order to fully come back and to be able to highlight it, to provide the training in a new way, and a new way for the world, really, in how education is continuing and there's no gap left. So with that in mind, there is a pilot being done presently to address the issue of virtual training, supervisory training competency. So Kerry, I will pass it on to you for you to speak a bit more around the external risk assessment.
Thank you. So in terms of the external risk assessment, we also, again, working jointly, we work together with unions to develop the request for proposal for an external company to come in and do a risk assessment on 3 of our highest acuity units. That risk assessment occurred between November and the following May is when we received the final report, which was just shy of 200 pages long. We had 49 unit-specific recommendations for the 3 units that were assessed and 90 organizational recommendations that came out of that risk assessment. So we've been working at that, the recommendations for it's around the 3-year mark right now. And you can see just in the chart that's presented here that we continue to make progress. So 56 out of the 90 are completed, 27 are in progress, and some of the not started are due to being linked to those that are in progress, so we can't get them started. So we've made huge strides in terms of these recommendations, and the recommendations are linked to policies and procedures. They're linked to physical space. They're linked to training. They're linked to processes that we have in place in terms of people being able to report incidents. So a wide variety of recommendations in terms of making our workplace a safer space. And the meetings continue. So we do bi-monthly meetings where, again, both local and central union leadership come together with management to provide updates on the recommendations, determine and agree upon when recommendations can be deemed closed. And some of the recommendations, even though they are deemed completed, we've made agreements that we actually keep them tracking at our Workplace Violence Prevention Committee to ensure that we don't lose sight of them. So for example, one of the recommendations was to track the number of and units that we do their code training for code white training for psychiatric emergency training. And we're going to present that as a regular standing item at the Workplace Violence Prevention meeting, just as one example. Carol spoke to the supervisor competency training, so doing that with our partner, the PSHSA, the Public Services Health and Safety Association, and as she spoke to, we rolled out that virtual pilot in February, and that has worked. We got fantastic feedback on that. And then, of course, this is just a sample of the zero tolerance signage that Carol also spoke to. And as she noted, it is in all of our elevators at all of our entrances, and it maintains being there, and that is close to 4 years later. Lastly, you know, we did that refresh. So as Carol spoke to, Carol and Pat Kern as co-chairs for OTSU and ONA respectfully, they had a secondment where we worked on a variety of different things together to ensure that refresh of Joint Health and Safety Committee. We ensured that all of our members were certified and offer that to any new members coming on. And then we worked to increase the representatives from both ONA and OPSU to help to share the work of JHSC and ensure that we had more and more health and safety advocates across the organization. One of the things we also did was we had a bit of a communications campaign where each month a new face of the JHSC were highlighted in posters across the organization with one of their favorite health and safety tips, and it also helped for people to get to know their health and safety reps across the organization. So this is just a picture of our mask-free. It was taken pre-COVID, don't worry, of our Workplace Violence Prevention Committee. And so in terms of the impact of the work, you know, I'll share this with Carol. The work continues, but we are in a much different place. There are daily challenges that come up. Before, those daily challenges would have sent us into a tailspin. But now we can come together and have good conversation, come up with collaborative ways to address them. Because we're on the same team. At the end of the day, we all want the same thing. We want our staff and then our patients to be healthy and safe. So I'll let Carol also speak to some of the impact that she's seen.
Thank you very much, Carrie. And you're absolutely right. You know, I've been in most of those meetings, especially on the workplace violence prevention table. And I remember from the first day we began to where we are today, and the huge difference. It's something for me. The first day I recall, you know, I was not sure if I should actually sit there or if I need to leave the space, because the tension was so heated. And I remember that day, but I also remember, I know now exactly where we are. And even when, you know, we're not necessarily on the same page, we can sit there and have those tough conversations. And yes, sometimes it does get really, really difficult to sit and listen to. But the best thing for me is that, you know, we sit there, you know, and be uncomfortable for those moments and actually listen, and we have those respectful conversations. So we have come a very long way. And yes, you know, and for me, it's taking those steps in the right direction. You know, it's one of the things that we constantly talk about is how to ensure that it actually trickles down right across the organization, that everyone within the organization should be feeling the same way, where, you know, it's recognized and acknowledged that it's not perfect, but, you know, we are working to get there. That is the goal, and that is what we strive for on a daily basis. You know, I'm the first to acknowledge and to admit that, you know, I'm the first to say I'm tired, and I'm not sure we're making any changes, but I can honestly say there are changes that's being done. And while we're not where we need to be, we're getting there. And, you know, together, we can only do it together. And the focus, we can't let up, not even a day. We have to continue pushing on. When we talk about, so, you know, there was a lot of focus on the workplace violence and the physical safety of workers and of all workers and patients, because the thing I always say is, if I'm not feeling safe, my patients cannot feel safe, and they cannot be safe. If my colleagues aren't safe, it goes hand in hand. So again, looking at the psychological safety of each and every one, you know, whether it's the employees and the patients, it's, you know, it's one of the top priorities for the organization. When we look at what's happening, I will let Kerry go through the governance structure, but when we look at what's happening today, it wasn't like that 4 years ago, I would say. But here we are today, where we are I'm thinking that we should be proud to see where how far we've come. We are not there yet, but we still have come a very long way. Carrie?
Yeah, so building on the success of the Workplace Violence Prevention Committee, we really tackled that physical health and safety of staff, which was challenging in and of itself, but tackling the psychological health and safety of staff even has additional challenges to that. So what you'll see from this governance structure, and it's just a really high-level snapshot, is that all of our staff health and safety focused committees roll up to the Joint Health and Safety Committee. So workplace violence prevention comes out of that. It kicked off in 2018, December of 2018. We have our horizontal violence, anti-racism, anti-oppression committee. And that committee has two subcommittees, the anti-racism, anti-oppression subcommittee with a focus on anti-Black racism currently, and our horizontal violence anti-oppression subcommittee. Whether it be a physical incident or a psychological incident or an incident related to racism, to oppression within the workplace, those are all health and safety issues, and that is why they roll up to Joint Health and Safety. And of course, all of these committees are co-chaired or chaired by worker members. And then there is links of these committees to the organization's strategic priorities. So we have Safe and Well, where there's a focus on both physical and psychological safety. And then a relatively new strategic priority called Fair and Just, with a real focus on equity, diversity, and inclusion. But the pieces of work that we put into place for staff are developed by staff to help with that buy-in and to ensure that we're putting in things that are needed and asked for by the staff, not what the management thinks that the staff needs. And that was a real switch for the organization. Listen to the staff, gain their feedback, and put into place what is needed by the staff. And we still have bumps in the road, 100%, but we're definitely getting much better. And to Carol's point, we have come a very long way. Speaking of staff engagement, I'll turn it over to Carol to start to speak through this. And this is the work around horizontal violence, anti-racism, anti-oppression, and the various different ways that we've gotten input from staff and also had events for staff. So Carol and I will share this slide a little bit, but you go ahead, Carol.
Thank you. So just to give a very brief outline about how the horizontal violence, anti-racism, anti-oppression began. Again, it's going back to being faced with incidents of oppression, racism, anti-Black racism to be specific, within the workplace, and noting that the amount of horizontal violence that was taking place on a daily basis within the units, the various areas of the workplace. So for me, recalling when I was directly faced with anti-Black racism within the workplace and recognizing it for what it was, and then the question that was asked was it horizontal violence or was it racism? Now, living in my Black skin on a daily basis, I cannot misinterpret anti-racism for horizontal violence. So when we agree as to what the issue itself was, it was recognized that while it was racism, we also recognize that horizontal violence has been on the rise within the organization, and also oppression, anti-oppression. So with that in mind, we, in 2018, the commitment that was made by the CEO, Catherine Zahn, was to ensure that dismantling racism throughout the organization was a priority. and continue to be a priority today. Again, looking at horizontal violence, anti-racism, and anti-oppression, as the co-chair for this committee, I work closely with Dr. Kwame McKenzie, and it's a daily thing where what people are experiencing in the workplace, it is real. And one of the things that I keep saying, until it is recognized that anti-Black racism, and I'm saying anti-Black racism specifically, because when you've addressed anti-Black racism, all the other racism will be addressed. Until it is recognized that it is a hazard, a real workplace hazard, we will never get rid of it. So I am proud to say that CAMH has taken the bold step of actually addressing this. And yes, you know, as I keep saying, going back, you know, we have come a long way and we have more work, much more work to do. But in being brave enough to take that first step, for me, this is one of the things that I like, and I will continue to say that being brave enough to actually acknowledge that there's a problem, that's the first step. Carrie?
Yeah, for sure. Taking that first step. So as you can see, and I'm not going to spend too much time, there's been a wide variety of both opportunities to garner that feedback from staff in terms of what their experiences are at the organization. And so with a variety of different surveys that have gone out, qualitative one-to-one interviews with individuals, we have had a total of now 23 healing circles led by an external facilitator, both virtually and when COVID allowed, a small in-person groups where we've garnered feedback, conversations with the president and CEO that have really helped to inform the staff priority recommendations coming within our anti-Black racism strategy. At the death of George Floyd in June, this committee immediately came together, and within a week of his death, we had a virtual anti-Black racism protest at CAMH, where we had just shy of 800 participants. Something, though, that was flagged to us is not very many of our Black staff attended that. And that also highlighted that there was a concern around trust and that faith in the organization that we were taking this seriously. So we really tried to ensure that we had ways to engage all of our staff and ensuring that we were hearing the voices of our Black staff. So to Carol's point, we can address, because if we are addressing anti-Black racism, we are working to address all forms of racism across the organization. Our inclusivity events to date have had external speakers come in to speak to us around their experiences and also to provide us guidance on how we can improve our workplace. Our first speaker back in September of 2019, we had a speaker, Hadia Roderick, come in, and she spoke to her experience as a Black woman on Bay Street, a lawyer on Bay Street. And it actually triggered us doing an audit of all of our recruitment processes. We've had Tanya Talaga come in, who's a writer, and she focused on anti-Indigenous racism. And then back this October, we had Orlando Bowen come in, once again focused on anti-Black racism. So the work continues, and it's so important to get that input from the staff. Some of the other work, obviously, just like with our Workplace Violence Prevention Committee, it's all about developing and executing that action plan. So collecting the data, educating people, ensuring that there are supports for staff, and then of course revamps of various different policies and procedures, tying into our workplace mental health strategy, just to name a few. So those continued relationship reset strategies that we had with workplace violence prevention continue here because they worked, and because each day is something new and a challenge, ensuring too that the work that we're doing is trickling down to the front line. So I'm cognizant of our time, and I'm going to hand it over now to David and Thomas, our ONA and OPSU presidents, who are going to speak to where we continue to go next as this journey continues.
Thank you, Carrie and Carol, for that. Thomas and I were going to sing this slide, but the orchestra canceled, so we're just going to talk through it. Let's talk about the rollout of the stress assess. So we thought, wouldn't it be a good time to maybe find out how people were doing psychosocially here at CAMH? So we thought we would do the COPSOC questionnaire, the Copenhagen Psychosocial Questionnaire, with our staff. Now, we thought if we rolled it out to all the programs, we would have a lot of work on our hands all at once that maybe we couldn't manage. So we thought, let's start with 3. So we started with nutritional services, Unit 3-5, which is a forensic unit, and outpatient clinics, the downtown east and the downtown west. Now, they're very similar clinics, but we did them separately because it's 2 different groups. So we really kind of did 4, but we called it 3 programs. We also added in some questions around the pandemic, added them into the COPSOC just to see how people were dealing with that as far as the working from home and the having to have their kids at home with them and stuff like that. So that was in there. Now, we ended up not being able to use what we got back from the 3-5 survey because not enough people responded for some reason. We're not really sure. It could be because they're very busy. We, like all the other hospitals, are very short-staffed, and this was in the midst of the pandemic, so perhaps they didn't just have time. So the other 3, downtown east, downtown west, and nutritional services, we did get back, and we are in the process at this point of putting together one-page reports from the full report, and then we will be taking it to those areas and sitting with the staff to go through the one-page report, and then having some brainstorming around what came up and what we can do as a group, the hospital, the unions, and the staff to correct any concerns. So that is in the process. And I'll just move on to the workplace mental health specialist role now, which is, I'll start off by explaining that we created a wellness program here at CAMH, which had a lot of things, a gym, and it had some psychological services that were an outside service that staff could use. And we had something called the COPE line, which was 2 staff that were available on site during the day. And if a staff was having a problem with a colleague or a manager or just experiencing stress or upset or difficulties of any kind, they could call and they could get immediate assistance. Not really sure why, but people didn't use it a lot. And we ended up having to kind of downsize that to the point where it just wasn't working. And so we dissolved it, which is how we arrived at talking to Hotel du Hospital in Windsor about a role they had there called the Safe Work Advocate. We sat down with them and we asked them all kinds of questions about how this role works, does it work? And then after doing that, we asked if we could speak to the actual person doing the job, which we did. And they were just an amazing person. I don't know how they found them. We tried to steal them, but they wouldn't come. So after speaking with them, we decided we were going to go with a similar role, and we were going to call it the Workplace Mental Health Specialist. Now, at this point, we are in the midst of interviewing. So that's going to be happening. We're very excited about it. It's going to have a focus on supporting staff and management in a variety of challenging scenarios, as I explained. It's if you're having a problem with a colleague and you need help to work it out, you need somebody to sit down with the 2 of you, perhaps, to be an in-between person or to take other steps or direct you how to take other steps if you need to move on to a more formal process. They're there for that. And as well as there'll be training on key policies and procedures as well. So we're excited about that, and that is happening in the near future. So hopefully we find somebody amazing like Hotel du Hospital had. And I'll just let Thomas speak to the COVID-19 response. Thank you.
Thank you, David. So I'm going to talk a little bit about the COVID-19 response that has been happening here at CAMH since early March of 2020, when the COVID-19 pandemic was declared as a pandemic by the World Health Organization. I want first to acknowledge that the response for both David with his own nurses and myself has been made easier and more effective by the work that was done on the workplace violence committees by Dr. Zahn, by Carrie, our David and my predecessors, Nancy Brigham, Danielle Armand, and Carol, whose work continues and carries into new presidents with the bargaining unit. The first thing that the employer took on to do was to communicate very well and very effectively through public affairs. There were at the beginning daily, if not twice daily, communication about the pandemic, what measures were being implemented, the expectations of employees and visitors to the hospital when coming in to CAMH. Through the first wave, David and myself met daily with the labor relations manager at the time, Fanny Marshall. This was because we were fielding calls and emails quicker than we could keep up. I'm sure everyone here will recall the Ministry of Health and the Premier's office were changing directives on how to respond to the pandemic multiple times a day. One thing that sticks out to me is in the early days, people who had been on vacation, if they were a healthcare professional, should come back to work right away and not quarantine, and that changed. Our meetings meetings were held with management and the joint occupational health and safety co-chairs, and Carol was attending those meetings on behalf of the OPSU local, bringing me very good information to help support the members. To this day, as we work our way through the third wave of the pandemic, which many of us hope will be the last, Dave and I continue to meet twice weekly with labor relations, now managed by Brandon Pajot as Fanny Marshall to be the director of People and Experience. Joint occupational health and safety committees have gone back to being a monthly occurrence, and as the pandemic seems to be more present with us, ad hoc meetings are scheduled as required. I just want to close by saying I'm very grateful for the good work that was done, and that relations between both unions and the employer changed, because I think certainly through the pandemic, which I think has impacted people both professionally and personally, we were able to support people who needed extra support in their personal lives and accommodate people at work. And I think when this pandemic ends, I certainly think that this will additionally strengthen the foundation that in all of the work we do between the unions and the employer will be done better and more effective. Thank you.
So I just want to thank my incredible co-presenters. This truly is a journey that will continue. Yes, we've been able to accomplish a lot together, and we all have that faith that we'll continue to accomplish more. And there's still lots of work to be done. And with that, we'll end off the presentation and open the floor to questions.
Great. Thank you very much, everybody. What a fantastic presentation. So much, sorry, you hear my dog in the background. So much work has gone into everything that you have done here. So I just wanted to quickly say, we'll go to some questions here. I know we're a little bit over time, so do want to invite those who want to stay to ask and hear some of the questions and answers. But I just wanted to say to our CAMH group, you know, one of the things I recognized and heard throughout your presentation was that, you know, CAMH is a whole new place. Working through this together, very proud of where you've gone and that you're continuing, that this is a continuous journey. So it's fantastic to hear that you are all working well and working together to move forward and continue to move forward. So thank you very much for your presentation. Fantastic. All right, so we do have a few questions. Let's start with, we have one from one of our OCAL staff here, wondering if you discovered and have you worked on any other discriminatory patterns based on racism, example, age, gender, sexual orientation, religion. Have you come across and are working towards any of those?
So I'll jump in, and Carol had responded as well that although racism is at the forefront right now, we definitely look at things from an intersectionality lens. But we do have structures in place to ensure that we are looking more broadly. And I'll give the example even of our completely revamped, what was referred to as our respectful and inclusive workplace policy is now going to be the anti-racism, harassment, and discrimination policy. And that speaks to all 17 identifications under the Human Rights Code. So that includes age and sexual orientation, gender. We did do, when we put out our new workforce equity survey back in February, it asks very detailed questions around a wide variety of backgrounds of our staff so that we truly understand who our staff are, and also the offerings of various different employee resource groups for various different people that identify, whether it be through their religion, their ethnicity, their sexual orientation, as well. So definitely on the forefront, we've just really focused work right now around anti-Black racism.
Excellent. Thank you, Carrie. Anything that you wanted to add, Carol?
Thank you very much for that. And just to tap on a bit further around how we identify things from an intersectional lens. Mm-hmm. We looked at one of the reporting systems that we have in place. We call it as PRIDE, and again that it got changed. We had inserted to specifically focus on intersectionality. What else would be included in that? And so we look at age, gender, and you know, all the other systems that Carrie spoke about earlier.
All right, excellent. Thank you. I'm not seeing any other questions in the chat box. I just want to know, is there anybody that wants to speak up live? You can go ahead and put your hand up. Okay, I'm going to turn it over to Terry. I think she's got a few words she'd like to say here too. Go ahead, Terry.
I just want to say thank you to Algoma and for CAMH for coming to talk today about the experiences. I'm so happy to see all this work, and I hope that a lot of other organizations go forth this way. I mean, we do still have organizations saying that racism and discrimination aren't health and safety issues and have no place at the Joint Health and Safety Committee. So thank you for all that work. And I'm just very happy that the mini-met is completed. And I want to thank all of the working group. You included Patricia, David Chesney, Laura Lazansky, Sari Saranen, John Odike, all the people that have been involved in that. Alec Farquhar, Andy King. It's been a lot of years. I said I want to have the mini-met, and we're not going to stop until we have it. And, you know, Leslie, for your design, for your patience, for all the edits. Erna, even contributing from a retirement. Nancy Johnson, thank you all. I'm very happy to have the mini-mint, and so we can consider it launched, and that is a big, another big check, another tool for workplaces to use to move forward in this journey. So thanks very much, everybody.
Thank you, Terry. John, was there any last things? I saw you pop up, so wasn't sure if you want to say something too.
Just thanks everybody for listening, and invite you all next week where we're going to continue our international emphasis on stories from other countries that have used the CAPSOC to address their issues. We also have a Canadian one, so please join us next week at the same time, same place.
Thank you, John. John, thank you everybody for joining today. We appreciate everybody's attendance, and thank you again, as Terry and John have said, to all of our presenters and you and Terry and John as well for your presentations today. A lot of great information, a lot of great solutions and ideas moving forward, and wonderful that you continue on your journey psychologically and physically safer and healthy workplaces. Thank you, everybody. Have a great weekend and see you all, I hope, next week. Bye-bye.